trying to do is draw the jawline first, and we try to avoid the treatment 1 cm above. We try not to treat in the 1 cm area right above the jawline. Okay. Same thing goes for the underneath as well, because today this beautiful lady, I'm gonna do the cheek area and the upper neck. Okay. Maybe I'll do a little bit, show you how to do the lower eye. Okay, using different tips, because I'm not going to just use one. Now, after this is drawn, and you see the angle of the mandible here, I normally follow down the hairline to the angle. Okay, and then draw a line. To 3. Okay, so basically what I'm trying to do is I'm going to be using 4.5 along this line. 4.5 along this line. So, sorry. I'm going to just put 4 here. And then 4 here. I'm going to treat 3 here, 3 here, 3.0, 3.0, 3.0 along this line. And then I'm going to, can you have this more down? She's, oh, no, you don't have to come. Okay, yeah, because it's very difficult to do when her. Okay, then can we move the bed maybe? No, you can not from there. From there. You can do bottom here. Ah, yes. And this is good. Okay, now one of the postures that she has to take when we're doing underneath, she has to lift her chin up high like this. Like this, okay, because the handpiece needs to go underneath. Usually we draw the midline, and then we spare this area, and then draw 1, 2, or if you want to do a little bit more, 3. Okay? Same thing we draw on this side too. Okay? Now, if we have this line, normally we don't need to draw more on around the eyes. Now, if we have this as a reference of where we're going to treat, yeah, if we map it, then even if we're going across, it's going to be easy because you can follow this line, yeah, going over here. Okay? So basically this will cover the top, the bottom. Now when we do the treatment up here, same thing as we would draw the bottom of the neck. Okay, so trying to draw where you want to treat. Okay, and then I told you in the beginning when I'm treating, I rather treat from bottom to up, and then from middle to out. Okay, because this is the direction that we want to improve. This is the direction that we want to improve. So basically, this is what we want. Huh? Right? So, okay, now, today I'm not going to do the forehead. I'm just going to do from here down to here and try to do it up to here. Okay? And then we'll try to see. Your forehead is not that bad anyway. Okay. So, design-wise, okay, any questions?
No?
Okay. So, we do know that there is a nerve going around here, going up like that. We know we have nerves going from here, going down like that, right? Like this, huh? So we try to be careful. It's not saying that we can't treat that area. We don't want to go too deep in that area. Because, of course, if you hit the nerve, it's a micro wound, so it's not gonna cut the nerves or anything, but it will produce more uncomfortable feelings and stuff. Okay? I did hear very rare cases that after opera, people had some sensory problems or nerve problems or whatever. But I've done several hundred cases and I never encountered that, so it's very, I would say, a rare complication. I did, in the beginning, use too aggressively around the eyes and then got bruises. That was seen pretty, well, not that often, but it could be seen sometimes. But I've never had that experience with the ULTRAcel, so I won't be too worried about that. So normally, the process that I do is, of course, just pre-cleansing the treatment itself, and then I use this alginate mask to cool it down. And then when they're ready to go, they don't even have redness. Not even a lot of redness on the face. Right after the treatment, there is redness. But after a cooling down process is done, when they're ready to go, there's no redness. So they don't know if they've gotten treatment or not. Of course they know because there are some areas that are uncomfortable. Now, after treatment is done, what the people can expect, some people, they can feel tenderness. So in some of the areas that you treat a little bit more, let's say around the jawline or in the temple or some areas that you want to pull more, and you do focus more shots in that area, then when they press, they feel tenderness. And that's good, because that means it has done some damage inside, and it's gonna be under work in progress. Okay? Alright, so let's start. Can I jump? Back in Korea, when I had a lot of staff under me, they would just spread it all around and prepare for me. But it's okay. Now, nowadays, I don't know how. And there is some difference in power for each machine. Okay, it's not a lot. Usually, I would use 0.8 to 1.0 for the 4.5, and similar for the 3.0. If it's 1.5, I would use probably about 0.4. So that is the power joule here. It's going to be used. I don't know, well, you can choose to decrease the spacing if you want to go in maybe a little bit tighter between the treatments. So what this means is power, I told you, I'm probably going to use 0.8 for the 4.5. And then the length is the actual length of this treatment. You see up where this line and this line is here? This is approximately 2.5. Okay? And the spacing is, you want to do treatments every 1.2 millimeters. Okay, so basically if you do 1.2 mil in a 25 mil, so that would approximately be about 20 shots. Yeah? 20 or 21 shots, right? So it's gonna produce micro wounds along that line. Okay? So this one you can adjust. Normal setting is 1.5. 1.5 I think is fine. Okay? And length is okay. 0.8, so we're ready to go. Okay? Normally I would use auto mode because I don't want to press every time. The way I do it is I glide. I slide it slowly. Okay? The benefit of sliding is you can always move when they complain too much pain. Okay? When you shoot one and they start to complain too much about pain, you don't want to detach the headpiece because eventually you're going to hit 4.5 mil on the skin when you're taking it off, right? So basically what I do is I will shoot. I'm going to shoot one shot. Okay? Okay, ready? It's going to be super painful.
No.
No. Okay. So this is one shot. Did you feel anything?
No.
Not too much, right? Okay. Alright, so basically what I do, one shot, two shot, three shot, four shot, 5, 6, 7. You do have to move a little bit, at least. 13, 14, 15. Okay, so you're slowly coming up and delivering 15 shots. Okay, why I slide? I told you I'm trying to, two effects. You slide the skin up and then you're pulling it as well. Okay, and then when you slide, when there is going to be pain around the mouth in these areas. So if they do start to move, you don't want to accidentally detach. That's a problem, like a potential problem, complication. Okay, so that's what I usually do. Okay, I'm going to do the same 15 shots here. You don't want to press it too hard because sometimes I get a little bit over aggressive and then I press too much and then say it hurts more from pressing compared to the actual HIFU itself. Right? Now, I don't want to go 4.5 in the middle, around the mouth, because some people, they have, one of the things that you do want to check if they have any dental fillings or implants or anything, because when you go in deep and you're pressing, you can't hit some kind of a bony or like a teeth, a dental structure. And if it does produce some odd, uncomfortable feeling. Sometimes they say it's pain, but some people say it feels very uncomfortable or bad. Right? So that's one of the things that you might want to ask, whether they had any kind of implant or a dental filling done recently, and if they have any gum issues. Okay, if you have any dentures or any gum issues or anything related, because around the mouth is one of the most painful areas, and if you don't check that and you keep on doing it, and then they keep on complaining pain, then when you find out later, then you're going to regret that you didn't ask it earlier, right? So that's one of the things that you might want to check. Another one you want to check is if they've done fillers recently. Okay, you do it and you didn't ask, then you're liable if they do a complaint. But if you ask and you can explain to them, as I told Dr. Earlier, okay, how long has it been? Now there is a chance of dissolving the filler a little bit, but the percentage-wise is not going to be a lot. Okay, so because the micro wound is very small, and it's not like you're doing it consecutively, right? You're spacing it like this. So total area is less than 5 to 10%. Less than, I would say, 5. That's going to affect the fillers, but of course you have to know. If you don't know, don't ask. Then if they bring up an issue later on, then it's a problem. I had one experience in Singapore when I was a doctor. I was working there. It's something different from cosmetics. I was doing a general medicine practice also, and then this lady comes in, I want to get a travel vaccine. Okay, well, where are you going to? Africa. So obviously she had a bunch of vaccines that needs to be done. And she was 45. And then she's the one that came in to specifically ask for these vaccines. So, okay, well, are you okay physically or everything? I checked all that. And then I signed off on the vaccine, and she got the vaccine done. She comes back after a trip 2 months later saying that she's pregnant. So, yellow fever vaccine, I think it has a slight possibility of, any kind of, because any kind of live vaccine stuff can be a problem. And of course, it's an assumption, it was my fault, but I didn't ask whether she was pregnant or not, a 45-year-old. Okay.
I'm not pregnant.
Oh, okay, well, it's okay. And then I got into a lot of, those problems. And I was like, okay, I'm pretty sure it wasn't at that time that she got pregnant, because it could have been any time, but because I didn't ask. So what I'm trying to say is, please ask. If there's a list of things that you want to do and need to figure out, please ask. Okay? Then you're off the hook. Are you pregnant? No. If she said, then I was off the hook. I just assumed that there was not going to be an issue, right? Yeah. So that's one of the things. All right. So I went 2 lines here. Okay. Am I not going to be hurt if I don't have this? If there's somebody sitting over there? All right. Because I can't see the field so well. Like this. Okay? All right. So from now on, I'm going to speak a little bit louder. I'm going to go pretty fast. Okay? I'm not going to stop and explain too much unless I have a major thing that I need to talk to you about. Okay, as I told you, I like to do crossing, right? 4.5, I told you I won't go into the central area, right? So I'll start from this line, okay? And then do about 10 to 15 lines here. Okay. Now, after one line is done, another line here. It looks very easy, right? Now, one other thing is, of course, if you do laser, if you do IPL, you know how to try to stabilize the other hand with this hand. So I'm using this as a bridge. So IPL is same, this is also same. You try to have this, the handpiece, always secure, leveled, on the surface all the time. Sometimes you don't realize, but it's doing this, okay? And if that does, I did see burn marks. And it was one or twice that I saw. Once with ULTRAcel, one with this, the Ultra, and one with this. And I probably was, too occupied with thinking something else, which I should have been. But it can happen. Okay. Now after this side, we do this. Now we're gonna do the bottom part. I try to use the gel from the other area. Up, please. Okay, now you don't want to go down to almost the vocal cord, okay? Just the submental area right here where there's a little bit drooping, right? Oops.
Yep.
Okay. Right, start. I use 4.5 in this area. Yeah? In the protocol, they say you don't want to use 4.5. But I use 4.5 here as well. I feel it's not so painful. That means I'm not hitting the vital structures, or nerves or anything. Okay. Now another one. Lift up, and then turn a little bit to the side, please. Okay. All right. So I'm going from here. Now, sometimes I have patients who want to get their jawline very defined. Okay, so when that happens, I go across one more. Okay. From here, I don't do this because it's very awkward position. I do it like a little bit slanted oblique, so it is much easier to do. You just have to follow this line and then come, right? So. Okay, yeah, so basically I'm done one side doing the 4.5.